Welcome to Health in Brief, your trusted guide to better living and well-being. Today, we are shedding light on a critical medical emergency that affects millions across the world. We are talking about stroke. So on the program, we shall be understanding what are the causes of stroke, how to identify when a stroke is about to happen, and most importantly, how to prevent it from happening. So stay with us as we unveil this to you. Stroke is a major cause of death with a prevalence rate of 7.3% and high mortality rates, especially in the first few months after a stroke event. It is a significant health problem in Cameroon, affecting all age groups. Statistics show that stroke deaths in Cameroon reached 11,199 in 2020, representing 6.25% of total deaths. About 1/4 of the population is exposed to the risk, and 90% of cases are preventable, according to health experts. Emma Laurent Camara is a jurist by profession. She is a stroke survivor and founder of Hope After Stroke Cameroon. One fateful day, she went to work and due to a violent headache, she found herself in the hospital. Here is her story and encouragement.
I had a stroke at the age of 32. It was mainly a violent headache. It started as a violent headache, which took me to the hospital. I was not aware of maybe at my age I could have a stroke. I then went for consultations, and I was put on drips for 2 days. I wasn't feeling better. I went to another hospital, another 2 days. Then I started feeling this heaviness on my right arm and my right leg. So the violent headache led to an ischemic stroke. And since then, I was demoralized. I lost myself. I lost my abilities. So it took a lot of encouragement to get me to be resilient, that when giving up is not an option, when life happens to you, you pick yourself up and you move forward. My mom, they took me because I went unconscious. I was taken to Limbe, where I was, immediately they told the doctor the symptoms I had. He sent me for a CT scan. And now they discovered I had a blood clot. Then they went detailing and discovered it was an ischemic stroke. Yes, when I went to the hospital, the first and second hospitals I went to, the second hospital that I went into a coma. When I discovered my right hand was heavy, my right leg was heavy, I went into a coma, and it was my mom who told me the story later, that was what had happened to me. So they took me to Limbe, where it was explained to the doctor how I felt, and he sent me for a CT scan. That was how they started treatment on me. Recovery from orthodox, unorthodox, you go to hospitals, or since as they associated with witchcraft, they'll send you, oh, I know this medicine man here, go here, go here. So it was basically massage. It was massage. There are different types, different herbs, different stuffs that they use for the massage. And the hospital, I was doing physiotherapy, you know, and physiotherapy doesn't come cheap, you know. So sometimes it was not easy. Maybe I would want to give up. I knew at my age, you know, I did not even imagine that a stroke would happen to me. I wasn't married. I had no child, so I knew my own was finished. So recovery process has been gradual. Somebody said to me, "Sick the can at one time, but you go na small. Yeah, so I just believe, and I know with time, everything is going to be okay. I'm very positive, and I know giving up is not an option. I cannot give up on my dreams. I can cook now. Before I didn't used to cook. Before I didn't used to do anything. But now I can cook, I can wash my baby, I can do chores in the house. I can, for instance, going to the office now, handling documents, you know, typing. I had to adapt to the changes, to my new reality. Yes, to the changes I knew I had to shift. Yes, before I realized it was not I had changed. If I kept on living in the past, in how I was, I will never recover. So I had to accept the reality first and make the progress towards adapting. Yeah.
We are now joined by Dr. EKANE Sharon. She is a general practitioner, and with her, we are going to learn and understand all what we need to know about stroke. Welcome, doctor, and thanks for accepting our invitation.
Thank you, Linda, for giving me the floor. I'm very glad to be on the platform this afternoon.
So let's start with the beginning. What is stroke? Because we are here to talk about stroke. So what is stroke?
Well, stroke can be defined as a medical condition that is linked to a sudden interruption of blood supply to the brain. And that interruption can be due to either a blood clot, or there can be a ruptured blood vessel that can actually cause bleeding inside the brain. And that will lead to some neurological deficits, like the patient will suffer from headaches, will suffer from loss of speech. It can also suffer from a sudden loss of consciousness. So that's what we can term stroke to be.
We understand that there are different types of stroke. Can you expatiate on that?
Yes, there are many types of stroke, but we're going to actually focus on the very basic ones, which are ischemic stroke. Here we see that there is a blood clot. When you see a blood artery, you see that a clot of blood will go and obstruct the blood vessel, and it will prevent blood supply from going through the brain, and that will prevent the person from actually receiving nutrients and oxygen, because the brain actually feeds on oxygen and nutrients, especially glucose. So when there is that blood clot, there is an interruption in blood supply. So that person will suffer from what we call ischemic stroke. That means that part of the brain has been actually blocked from receiving oxygen and nutrients. Secondly, we will go to hemorrhagic stroke. In hemorrhagic stroke, it's different because, it's not only a blood clot, but we see a blood vessel that actually bursts. And when it bursts, it causes bleeding all around that hemisphere of the brain, because the brain is divided to different hemispheres. So we see a part of the brain that is filled with blood, and that excess blood that has actually been either surrounding the brain or within the brain, it will actually cause crisis, and the person will suffer from deficit. Then there is also what we know as as transient accident, transient ischemic attack. When you say transient ischemic attack, yeah, it's a kind of a minor stroke. We call it a mini stroke, and it lasts less than 24 hours. It's actually a stroke to warn the person that it's like this. You are actually at the verge of having a major stroke. So they usually call it a transient. That means it's just partial. It's a means to just inform the person that here you are, there is actually a problem, you have to solve it. So those are the major types of stroke that we have.
Now, before we get to identifying when a stroke starts,
yes,
what are the risk factors?
Risk factors, all right. As risk factors, there are what we call the modifiable risk factors and the non-modifiable. When you say something is modifiable, it means it can actually be modified, it can be changed. So like the modifiable risk factors, we have firstly hypertension, which is the major risk factor of stroke, followed by diabetes, followed by high cholesterol. And mind you, those who smoke a lot, you always tell yourself that no, smoking is not a problem. Smoking is a modifiable risk factor and it's dangerous. There is also the aspect of drinking alcohol excessively. I said drinking alcohol excessively because there is the way to drink alcohol and then there's excessive abuse of drinking alcohol. And then now, after that, there are also those who don't do any activity, that are physically inactive for long periods of time. They don't do anything. They just sit and they do everything for them. It is a risk factor. And also the fact of those who suffer from heart disease. Like we see children who have heart disease from childhood and they grow up with it. They are at risk of developing a stroke because people say stroke is only for the elderly. But no, stroke also affects the younger ones as well. And I'll go now to the non-modifiable. Firstly, age is a non-modifiable risk factor. When you reach an age of 55 years and above, you're at a very high risk of developing stroke, and followed by the fact that in a family, there's usually called family history of stroke. The people in the family who have a history of stroke, you can hear that the grandfather had stroke, the auntie or the auntie at 30 years, at 25 years had stroke, then that means that you're predisposed also to have stroke. There is also the fact that there are genes that have been transferred from from family to family. We hear of sickle cell disease. Those who suffer from sickle cell disease who are at high risk, and those genes are transferred from parents to children. So they are at high risk also of developing stroke.
We've had situations where people say they think too much, and when you overthink yourself or you overwork yourself, are those things also part of the risk factors?
Of course, because stress increases blood pressure. So when you increase blood pressure, then it leads you to what? High blood pressure. We see that women or men who think a lot, when you go and take their blood pressure, you see that they're above 140 or 90. So all of that, because of the fact that there is stress, there is high blood pressure. And because high blood pressure is the major risk of developing stroke, it leads then to stroke because of that stress.
Now that we know the risk factors, how do we identify stroke when it's coming? What are the symptoms like?
All right. What we have to understand is that the symptoms of stroke appear suddenly. They're very spontaneous. So when you acknowledge or you see somebody who says he has sudden strong headache, like the head is pounding so hard, that's already a symptom. Secondly, we also have people who say they have a sudden numbness of a part of their body. He'll say he cannot feel his hand, he cannot feel the legs, they cannot move their hands, the body is weak, the part of their body is weak, the arm, the face, the leg is weak. That is another symptom. Thirdly, we can also see people who suddenly lose their speech. They cannot talk, they cannot actually respond, even when you actually speak to them, and they are disorientated. We also have those who suddenly lose coordination. When they say coordination, he's trying to maybe take a few steps and he doesn't know how to take steps anymore, or moving from the staircase, he falls up because he has lost his coordination. That too is a call for And at that point in time, you should not actually wait. You should call for help.
We hear of the FAST method. Can you explain that to us? What is all about the FAST method?
All right. The FAST method is just an acronym that they actually put together to actually identify the symptoms of stroke very quickly. I'll break it down for you. FAST for F means face drooping. When they say a face is drooping, that means that when you ask the person who you suspect to have stroke, when you ask him to either smile, when he smiles, you notice that one side of the face, it feels like it's falling off. Why they call it droop? Because it's like it falls off. You see like the eyes is closing now, the cheeks are maybe fall out, and then now at the level of his smile, he cannot really smile anymore. It has fallen out. It's like, we would say that like the old people, those people when their cheeks are actually falling off, that is actually what face drooping is. So when you want to actually identify, you ask the person to smile, and you notice that change. You notice that the smile cannot go, the two sides cannot go up that way. Yes, one side is falling. So that is what they call face drooping. And most of the time, either it's on one side, it's one-sided when it's actually beginning. Then now with time, you can actually notice that the two sides may fall out, but it's very rare. Secondly, A means arm weakness. You can ask him to raise his two arms, and you notice that one of the arms is falling down gradually, like he cannot support his arm. Normally, when you say raise your hand, you can raise your hands at the stance, but with this person who you suspect stroke, you'll see that one of the arms are actually falling down quickly. Then S actually means speech difficulty. You ask him maybe to say a simple sentence, like maybe good morning, and you see he starts speaking like a little child, blah, 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 blah. He cannot actually respond properly. Then the T means time to call for emergency, call for help. Don't sit and be waiting. At that point in time, you know already that those three are already enough to tell you that this person is actually beginning to have the symptoms of stroke. So we call emergency, always call for help.
And now, in case of emergency, what should someone who is suspecting that another person is having a stroke, or probably you're beside someone and you're suspecting, you kind of notice these symptoms that you just mentioned, what should the person do as an emergency measure at that time?
All right, thank you very much, Linda. That's a very, very pertinent question, because many people, when they see maybe somebody falls unconscious, they notice that somebody maybe cannot use his one leg or his one arm. Instead of them to call for help, they stand and they gather together. They take pictures. Meanwhile, it's an emergency. Thank you. It's an emergency. That is an emergency. You have to call for help, and don't take somebody to the hospital alone, especially somebody who is developing signs of stroke, because you have to monitor that person till you reach the hospital, because those kind of people are very, very, very delicate. They're vulnerable. At one point, they can actually lose consciousness completely. And at that point in time, you are rushing the person to the hospital, and you cannot be following up the person behind you. Before you know it, maybe you reach the hospital, the person is already dead. Meanwhile, if you go with somebody, the person can be monitoring his breathing rate, monitoring his activity. If the person is still there with you, if the person is responding to you. Because remember, we said that the symptoms of stroke are very sudden. They happen all suddenly. You can see, the face will be drooping, you lose numbness, and before you know it, he's maybe closed his eyes and he's giving up the ghost. So it's very important to go with somebody to the hospital. It's an emergency. I'm glad you said emergency, because it is an emergency, and it calls for help, and go to the hospital. We always advise to go to the hospital. Very seriously.
Now, there is another situation which it comes in at the level of the hospital. Our stroke survivor, who we listened to earlier, she said she went to the hospital and they gave her medications for the headache. At that point, the doctors could not identify if it was stroke. Now, when you go to the hospital, who should the patient meet for a case of suspected stroke?
It cannot be identified as a stroke immediately, the majority of the time, they always lead you to the generalist. That is true. But we will not say that you should give painkillers to say that, okay, reduce the headache, and then we leave it like that. They always ask for lab exams, always ask for extra examinations to be sure. Because even when you go to the hospital and you say you feel this very violent headache, we always start with the antalgics that are given. But when you notice that the antalgics are not doing the job that is supposed to be done, they insist, even before that, they insist to actually do extra exams. And at that point in time, if it persists, that they send the person to the specialist, the neurologist. But the major thing is to always do the exams that are supposed to be done. It's preferably a CT scan, because a CT scan that can actually identify that it's like this is an ischemic stroke that is being built up, or hemorrhagic stroke. It is always important to do a CT scan.
Now, for a stroke survivor, what's the healing process like? What should be done to facilitate the process?
To be honest, the healing process of stroke is a very, very long one, and it's very gradual. I think even the neurologists will even say it, that they have to take their time. They should not rush it. They should be patient, because the issue with stroke is that when we develop all the numbness of the part of the body, it's important that you allow the body to recover. There are different phases of healing. There is the acute phase. They always call it the acute phase, because it is at that point in time that you are rushed to the hospital because you're presenting the first signs and symptoms, the headaches, the numbness. That's the first stage. They try as much as possible to give you the necessary treatment to prevent complications. Then now, there is a second phase we call the rehabilitative phase. That's a phase now that after we have done the CT scan, we identify that maybe it's an ischemic stroke, a hemorrhagic stroke, you're put on treatment to prevent complications. They now continue with what we call the therapy. You have to go for physical therapy, and they always advise the patients to follow their therapy. Don't miss your drugs, don't miss therapy, do not miss any of it, because you have to recover as much as the blood, because it can be a blood clot. They give treatment to actually resorb the blood or dissolve it so that it flows now in the body normally, or they can actually give a drug to actually help the blood to resolve itself and circulate normally in the system. So if you are taking the treatment to resolve what is in the brain and not doing the therapy that will help the body to recover, then you cannot be able to recover fully. You may recover in the brain, but you not recover fully physically, because you have to recover normally speech, because there's therapy also for speech. There are those who lose their speech, who lose their ability to speak properly, or because of the stroke. There are people who lose their ability to use maybe a part of their body properly. So it is important to follow up with the therapy, the physical therapy, the speech therapy. And we also advise them to go for what we call the psychological help, because it's not also easy. It's actually a difficult phase for them. Those who have undergone stroke and who suffer from all the part of their body being numb, it's really difficult.
All right, Doctor, we are coming to the end of this discussion, but we cannot go without you giving us your last word. What's your advice to stroke patients and even to the survivors out there?
If you have had any episode of stroke, if you have been a survivor and you are currently on treatment and all, I encourage you to actually continue with your treatment. I encourage them to also follow their doctor's advice, because there are many who give up along the way because they say it's tiring, it's hard, it's difficult. But you can do it. You can do it. You have to follow therapy. If there is anything that you're not doing, like I explained earlier, there are modifiable risk factors. If you know that you're actually within those risk factors, those who don't like physical activities, or like doing sports, you don't like, and you take alcohol excessively, it's actually the time to stop all of that, to build a healthy lifestyle, and to encourage those out there that even if your brother, your uncle, your sister has had stroke before, it doesn't mean by force, by fire, that he must have stroke. No, no, no.
Thank you so much, doctor. Thank you for honoring our invitation.
You're welcome, Linda. Thank you too.
That was Dr. EKANE Sharon, General Practitioner. Ladies and gentlemen, that's it for today's edition of Health in Brief. Stroke is a major public health problem and the second most deadly disease in the world. So, with everything we've discussed today, take precaution, make sure you follow the doctor's advice and live a healthy and wealthy life. Bye-bye for now. See you on another edition.